everyone. Welcome to researchmd.com. Today we're going to do an analysis of a recent paper published in JAMA, and it's about COVID-19 during the pregnancy and its complications. Okay, and again, my name is Pramil Cheriyath, and I work as a program director for internal medicine residency program, transitional residency program. I teach medical students. I'm also an assistant professor of medicine, Arkansas School of Medicine. Okay, so let's get into our analysis. So if you look at, before we start, I just want to make sure this analysis is not for medical advice. Okay, if you, you always need to consult your physician before you take any medical advice. I just wanted to make sure this is only for educational purpose. So let's go back into the COVID-19 infection in pregnancy. As we know, COVID infection is globally biggest pandemic we ever seen. A lot of complications to many people. So what happens during the pregnancy? Does it cause problems to the mother? Does it cause problems to the baby? Those are the main thing we just kind of take a look. We wanted to take a look. Okay. This is always an anxious moment for expectant mother or people, the parents who are trying to have a baby during this pandemic. So it will shed some light into what kind of complications we can have. So this paper was published in JAMA, one of the biggest names in medical journals out there. So we got a copy. This is the title of the article is Maternal and Neonatal Morbidity and Mortality among pregnant women with and without COVID-19 infection, the inter-COVID multinational study. Okay, so let's look at the objective of the study: to evaluate the risk associated with the COVID-19 in pregnancy on maternal neonatal outcomes compared with the non-infected concomitant pregnant individuals. So what they did is they have two arms or two groups. One group with the pregnant, both are pregnant. One group of pregnant patients with COVID infection. The other pregnant women did not have any COVID infection. So they looked at the complications or outcome in those groups. So design and population. It's actually a multinational, 43 institutions, 18 countries. Large number of patients. They got 2130 pregnant patients in the both when they combined it. They're unmatched, which will come back to that. So they are, there's a large number, just like we said, 2130 pregnant patients. Now let's look at our patient. Again, we talk about 2,130 patients. Out of this, 706 patients are COVID positive and pregnant, and 1,424 are COVID negative and also pregnant. And just wanted to mention the countries they used in the study include Argentina, Brazil, Egypt, France, Ghana, India, Indonesia, Italy, Japan, Mexico, Nigeria, North Macedonia, Pakistan, Russia, Spain, Switzerland, UK, and the US. Now let's look at the timeline. The study was actually started in March 2020, 8 months, and they went into October 2020, the study was finished. Measures of outcome. What did they look at the measures of the outcome? Main thing, they looked at the maternal mortality and morbidity. I just want everybody to know the difference between mortality. When we talk about mortality, it includes death. And the morbidity is like a group of illness, you can say that. They're not actually dying, okay? And severe neonatal morbidity and mortality, they looked at it. Severe perinatal morbidity and mortality, they also looked at it. There's some terms you may want to look into, like maternal mortality morbidity index. They used, you have to know those three terms. I'm just even though it's a little bit complicated, what they do is they create this index with all this complications and call it an index, and they looked at it. Okay, so let's look at maternal mortality morbidity index. So that means death is involved, also complications involved, right? Vaginal bleeding, pregnancy-induced hypertension, preeclampsia, HELP syndrome, preterm labor, infection, maternal death, all of them clumped together, they formed an index and did the analysis. Now look at the neonatal, right? Neonatal mortality index, which is include bronchopulmonary dysplasia, hypoxic ischemic encephalopathy, sepsis, anemia requiring transfusion, patient dectus arteriosus, intraventricular hemorrhage, necrotizing or retinopathy of prematurity, SPNMI, again, it's neonatal mortality morbidity index. SNMI is only the morbidity, but when you come to SPNMI, they include the mortality and morbidity. That includes intrauterine death, neonatal intensive care units stay greater than 7 days. So the number one outcome they looked at it, which has like a everyone is interested in, is about the maternal death. So there was in the COVID positive pregnant women 11 deaths. Okay, in the other arm there's only 1 death when they're COVID negative patient when they compare both groups. So what does that tell us? The relative risk is 22.3. So that to convert into layman's terms, if your pregnant women get COVID, they are 22.3 times more likely to die. This is the major important finding, which have relative risk of 22.3. So we need to take this very, very seriously. Okay. So then they looked at some other outcome. We talk about maternal morbidity. It's not death, but what are the other complications we call morbidity or illness? They looked at pregnancy-induced hypertension, preeclampsia, infections requiring antibiotic, admission to ICU or high dependency unit. Okay, when you talk about preeclampsia, that means patient after 20 weeks of pregnancy, you can have hypertension, you can have a proteinuria, protein leak through the urine, which gives you a lot of complications, including seizure and death. So remember that. So let's look at the first one, pregnancy-induced hypertension. 58 out of 702 in the COVID positive, which comes around 8.2% have developed pregnancy-induced hypertension. In the other group, only 5.6 developed pregnancy-induced hypertension. So there is a big difference. There is a statistical analysis. Relative risk is 1.46, my friends. So if the pregnant women, again, for layman's term, if a pregnant women get COVID, they are 1.4 times more likely to get pregnancy-induced hypertension. Now, pregnancy complications, let's look at the other one. Again, this is more about morbidity. So we're going to look at preeclampsia, which means, after 20 weeks of pregnancy, you can have hypertension, proteinuria, which leads to so many complications. So preeclampsia was developed in 8.4% of the COVID positive pregnant women. At the other group, 4.4% in the COVID negative pregnant women. Again, big difference. So relative risk is 1.76. We're going to convert to layman's terms. If you're pregnant, get COVID, you're 1.76 times more likely to get preeclampsia. Now, other infection during pregnancy requiring antibiotic, 3.6% in the COVID positive group, only 1.1% in the COVID negative pregnant group. Again, relative risk is 3.38, higher. So layman's terms, if pregnant women get COVID, they are 3.3 times more likely to have infection, which require antibiotics. Okay. Now, how many of them get admitted to ICU? 8.4% in the COVID positive pregnant group, only 1.6% in the COVID negative pregnant women. So relative risk is 5.04. That means, layman's term, if pregnant women get COVID, they are 5.04 times more likely to get admitted to the ICU. Delivery complications, cesarean delivery. So 49% in the COVID positive women underwent cesarean section. What in the other group, only 38.4 in the COVID negative group. So relative risk is 1.28. So if pregnant women get COVID, they're 1.2 times more likely they can go into, they can do a cesarean section. They end up having a cesarean section. We don't know why. This may be like more analysis need to be done. So perinatal complications, when you look at the severe perinatal, SPMMI, right? Severe perinatal morbidity mortality index. Again, morbidity is involved in this, right? Neonatal death is, intrauterine death is involved in this. So it's a very, a big number, a big concern over here. 17% in the COVID positive pregnant women, and only 7.9% in the COVID negative. Look at the difference, 17 versus 7 point, big difference, right? So relative risk is 2.14. If the pregnant women get COVID, mother and baby are 2.14 times more likely to have perinatal complication, which include death to the baby, okay? Remember that. So fetal complication, preterm death, again, 22.5% in the positive pregnant, COVID positive pregnant women, 13 points in the COVID negative pregnant women, relative risk is 1.59. Again, you're 1.59 times more likely to have a preterm birth if you are COVID positive and pregnant. Remember that, okay? So fetal distress in developing the babies, 12.3 versus in the COVID positive group, 8.4% in the COVID negative group. You look at the relative risk, which is 1.70. We're going to convert to a layman's term. If pregnant women get COVID, their babies are 1.7 times more likely to develop fetal distress, okay? Remember that. Let's move on. What is the risk of transmission to the baby? They did 416 babies with the COVID positive mothers were tested. Only 12.9 were like positive. And most of it, like 72% of the people underwent cesarean section. Maybe the others were suggesting, maybe because of contamination during the cesarean section, maybe that has something to do with it, okay? So, the other question, expectant mother or like parents have is like, can I breastfeed my baby when when you have COVID? Studies have shown breastfeeding is not associated with the transmission of COVID, okay? Relative risk is low, and if you look at the confidence interval, it does include 1, so it's not significant, okay? Again, the statement in this study, breastfeeding is not associated with the transmission of COVID. Now let's look at the other issues. COVID infection in pregnancy is not associated with, it's not associated with vaginal bleeding, it's not associated with anemia, it's not associated with preterm labor, induced labor, premature rupture of the membrane, and spontaneous preterm birth. Okay, remember that. Now, this is another. Let's look at the symptoms when the patient. What happened if you got COVID and you're pregnant, asymptomatic? You're still at a risk of preeclampsia. Okay, 1.63 times more. If you look at all the way in this beautiful diagram, you can say you're still at a risk. But if you started developing symptoms, first, if people have diarrhea and vomiting, they're high risk for severe neonatal mortality index, severe maternal mortality morbidity index. All of this risk is high. Okay, with the fever, risk goes high. With the shortness of breath, again, the risk is high. With the fever and shortness of breath, if you look at SPMI, severe perinatal morbidity index is the highest, 5.09, 5 times more likely. Make a point of that. And preterm birth is also high. So the more symptoms of when people, the thing you have to take it from this slide is with the fever and shortness of breath, the complications are much high. But even if your symptoms, even if you're asymptomatic, you're still at risk of preeclampsia. So there are complications, even the asymptomatic patients, okay? Please remember that. So it's a very good slide. Look at how many symptoms they have and all that. Now, people, in the general population, we all know obesity is associated with a higher problem when you get COVID. Is it true in the pregnancy? That's the question asked. Unfortunately, it is true. When you are overweight, that means, greater than 25 BMI, you're more likely to have, maternal mortality morbidity index. You're 1.81 times you could die, okay? And then, severe neonatal morbidity index is also high. So remember that. Obesity and COVID, the complications are high. Now, what are the other major findings from the study? Okay. 1, if the symptoms last more than 5 days, adverse events are more, especially if you have respiratory symptoms like fever, cough, and shortness of breath. Remember that. If your symptoms kind of go away within less than 5 days, you can still have complication, but less. If you have more than 5 days of complication, you go like 5, 10, 15 days, the complication rate is going to go high. Now, longer the duration and the higher the complication. Now, let's look at, when you look at the overall the population, let's find out what are the symptoms these patients present with. 34% had a cough as an initial symptom, followed by 28% had fever, 17% had loss of smell, just like the population. So, the most likely, most of the people, when you come in, when they have a fever, cough, and there's loss of smell, pretty much you can say, probably it's time to go to check for COVID. Most likely you have COVID, okay? Now let's look at the weakness and the strength of the study. So our research team kind of looked at what are the weakness of the, let's look at the strength first, okay? It's always like, again, it's a great study. It's published in one of the biggest names in scientific world, JAMA, Journal of American Medical Association, right? And they do, I mean, they have a large number of patients in the study. They use multiple countries. The good statistical method, I think we need to give a lot of credit to these people. They looked at so many creators, so many models to come up with, our analysis kind of results on that. So we need to congratulate the authors for that. And created several more extensive analysis, multiple outcomes they looked at. They looked at obesity. They looked at all the other things, different index they formed, severe neonatal mortality, morbidity index, combining all that. So a lot of credit go to the to the authors on the study. And now let's look at the weakness of the study. If I like, everything we need to a critical analysis. The biggest weakness, I think I would say, the study was done when there was Delta variant predominant. Now more variant. Now the predominant variant is Omicron. So it's less symptomatic. So we don't know, what are the complications? So we just have to remember that, okay, this study was when Delta variant was predominant. Group is not balanced. If you look at it, you got 706 people with the COVID positive pregnant women, and then almost like 1,424 in the other group who is not COVID negative. So there is an imbalance, right? So what they could have done is there is something called propensity score analysis to balance this. I think that would have been a better approach to looking at the outcome. And then there's so many countries. When you have so many countries with the study, if you look at the Western countries in the United States, we have stricter IRB guidelines to follow, stricter reporting mechanism and all that too. So I don't know, other countries, do they have stricter, stricter reporting? I'm not so sure about that. People with COVID diagnosis, COVID diagnosis are already at high risk, right? We have some people in this in the COVID group are more high risk. That means they were COVID group, COVID positive pregnant women. Recreational use was 2.6. COVID negative was only 1.4. This kind of data is kind of skewed, right? Skewed towards the people with the COVID positive. More obese people in the COVID positive group. That also data is skewed. Has diabetes and hypertension baseline, so data may be skewed in that thing. And then they did not do the trimester-based analysis. That's also weakness, and we still didn't know exact number. How many kids died in this group would be very nice to know. Okay, so in conclusion, this is a great study. What the assumption we can make is the study clearly indicate COVID infection during pregnancy is associated with complications to the mother and the baby. Okay, more studies needed to be done to look at what complications and more. We already said about the strength and weakness of the study. So we recommend further studies looking into a very important subject. Okay, thank you so much for watching today. We'll be back with another analysis. If you could subscribe to this channel, we will greatly appreciate it, so we can provide more analysis like that. Okay, thank you. Bye-bye.